I'm Dr. Sally Beazlie-Walker. I work at the Plymouth Family and Internal Medicine office in downtown. All right, so you guys sent me some questions and I'm going to go ahead and answer them now for you. The first question is, what steps can I take to lower my cholesterol? I always think the first thing to do for this is to know what your cholesterol numbers are to begin with. The best way to do that is to meet with your primary doctor and have them run some fasting blood work on you. If the numbers truly are high, and usually I recommend calculating a vascular disease risk score, and then if that score is high, then talking about lifestyle modification. And regarding that, basically all that means is diet and exercise. I know it sounds simple, but it can often be very difficult to modify both of those things, especially in the busy world that we live in. So with diet, typically that means lower trans fat, so fatty foods, fried foods, red meat, and then exercise. For exercise, usually we recommend about 30 minutes of moderate activity 5 days a week. If you're trying to lose weight, we recommend increasing that to about 60 minutes. Again, very hard to do, much easier said than done. One of the things that I personally really enjoy talking to patients about is diet, exercise, and weight loss management. So if that's something that interests you, I would love to meet you and we could talk more. The next question is it true that a glass of red wine is good for the heart? So I like this question a lot. There are a lot of research studies out there that do suggest that red wine can be helpful for the heart, specifically decreasing heart disease risk. Red wine has really good antioxidants in it, as well as flavonoids. These are all good things for health. They also are found in grape juice and other juices like pomegranate juice, some cranberry juices, things like that. So don't think that you just have to drink wine to get these benefits. And as a caveat, I always like to say the American Heart Association always recommends drinking in moderation. For men, that means 1 or 2 drinks a night. For women, 1 drink per night. And a drink equals 12 ounces of beer or 4 ounces of wine. So kind of keep that in mind, not those big wine glasses you see on Facebook. What is the difference? The next question, sorry, is what is the difference between cold sores and canker sores? So cold sores are typically the sores that you find around the lips, and these are caused by viruses, most commonly the herpes virus. Canker sores are typically found inside of the mouth, and they are also known as aphthous ulcers, and they have a lot of different causes: stress, trauma, eating too much of certain foods or not getting enough nutrients. Sometimes viruses can cause those as well. And then the last question is, does vitamin D prevent colds and flus? Unfortunately, the answer is no. A lot of people will feel better on vitamin D, especially right now in the winter time in Indiana. But the only prevention for cold and flu really is just good hand washing, making sure you're sleeping well and eating well, making sure you're supporting your immune system as much as possible. And again, that's just with sleeping well, eating well, maybe increasing your vitamin C level. So I just want to take a moment to thank everyone for sending in their questions. I would love the opportunity to talk more with you about any of these subjects or anything more. I'm accepting new patients at the Plymouth Family Practice and Internal Medicine office downtown. I look forward to talking with you more. Thank you so much.